For wrist flexion and for wrist extension, place the patient's arm 1/4 of the way off the table. Place their arm 90 degrees of abduction as well as 90 degrees of flexion. Their elbow should be flexed to 90 degrees as well. The fulcrum is going to be distal to the ulnar styloid process. The distal arm is going to be in line with the fifth metacarpal. The proximal arm is going to be in line with the midline of the ulna, or the lateral epicondyle. Ask your patient, for wrist extension, ask your patient to point their fingers towards the ceiling. Ask your patient to point their fingers towards the floor for wrist flexion. For passive range of motion of wrist extension, ask the patient or guide the patient's fingers into a flexed position, into an extended position. For wrist flexion, point the fingers towards the floor until you feel the firm end feel. Bring the patient's hand back into neutral and measure wrist flexion and wrist extension. For measuring wrist extension, place the fulcrum of the goniometer just distal to the styloid process of the ulna. Place the distal arm in line with the fifth metacarpal and place the proximal arm in line with the midline of the ulna or the lateral epicondyle. Passively move your patient's arm so that the fingers are in extension. Again, 65 degrees of wrist extension. And for wrist flexion, I'm getting 90 degrees of wrist flexion.
I am going to measure wrist radial and ulnar deviation. Ask patient 90 degree of shoulder abduction and 90 degree of elbow flexion, and place the whole forearm and hand and finger on the table. First, observe the patient's active range of motion. Could you cut a chop to your left? That is radial deviation. Place in the middle. Could you cut a chop to your right? That is ulnar deviation. Second, passively move the patient's wrist in radial and ulnar deviation and feel the end feel. Could you cut the chop to your left? This one is a radial deviation. End feel should be firm because of the contact of radial stylo process and scaphoid carpal bone. Put in the neutral. And could you cut a chop to the right? This is ulnar deviation, and the end feel should be firm because of the radial collateral ligaments tension. Play in the middle. And third, we're gonna measure the radial and ulnar deviation. The fulcrum should be placed on the capitate. Ask the patient wristband so you can find the Leaser's tubercle, and after that there's a lunate and you can feel the capitate. So place the fulcrum on the capitate, and then stationary arm should be placed in the midline of the forearm, and then movable arm should be placed on the third metacarpal. Could you cut a chop to your left, which is a radial deviation, and it's gonna be 28 degree. Put in the middle. Could you cut a chop to your right, which is ulnar deviation, and it's gonna be 37 degree.
All right, so we're going to be measuring the flexor length of the wrist. So what we're going to do is you're going to have the patient have their elbow in complete extension and their wrist in complete extension and neutral with all their fingers in complete extension. You're going to have the patient bring their fingers towards the sky. So we have everything taut right here. Okay, you can relax. Same thing as before. Our fulcrum is right at the triquetrum, right distal to the ulnar styloid process. Our stationary arm is in line with the ulna to the lateral epicondyle, and our movable arm is right at the base of the fifth metacarpal following the metacarpal. Same thing, we're going to have the patient bring their fingers towards the sky. Okay. Getting about 68 degrees of motion. Okay, you can relax. Next, we're going to be measuring the wrist extensor length. So what you're going to have the patient do is make a fist. Okay, this is bringing the extensor length completely over the PIPs. Same thing, you're going to have the patient bring their fist towards the ground. See, it's nice and taut. Okay, relax. I'm going to do the same thing. The fulcrum is right at the triquetrum and distal to the ulnar styloid. Our stationary arm is along the ulna to the lateral epicondyle. I'm going to have them bring their wrist down. Okay, we're going to measure that along the base of the fifth metacarpal, and we're getting about 39 degrees of motion.